Over the course of the last 20 to 21 months, we've gathered a lot of data. Some of it has been good data and some's been a little bit more controversial. But I can tell you that overall, the registries show that patients with MPNs are still at higher risk than those age-matched of controls for death or serious disease due to coronavirus. So we still have, as practitioners, an obligation to really make sure that our patients are protected as much as possible. Now, in some cases, or in many cases, that's by receiving the vaccine, one of the 3 vaccines or 4 vaccines that are approved for the treatment of coronavirus. However, there are some patients who are not going to respond to the vaccine, at least initially as well. We just learned actually last night that the Food and Drug Administration here in the United States is approving 3rd doses, so boosters, as they say, for immunocompromised patients, for example. The details of that are still to come out, and I may have more at the time of our talk at the MPNs, at the MPN meeting. But I think that's something really interesting to watch for. The other things we've learned about coronavirus is that in this population is that there is probably a significant harm if patients are on ruxolitinib, that JAK inhibitor, and that are stopped. We learned that from the Italian data that we heard a little bit more of this morning as well. And we know that patients with MPNs have a predilection for either venous or arterial clotting, and that may also synergize with the inflammatory response to the virus.